Hi, everyone. I'm Brayden, a second-year med student with UQ-Ochsner. Originally from California, I'm finishing up my last year in Brisbane, and I'm talking with Bhumit Desai, who graduated in 2019 from the Ochsner program and has done his orthopedic residency and is now currently in Birmingham. Bhumit, thanks for meeting with us.
Yeah, absolutely. Happy to be here.
So I'm just going to ask you some questions. We can just take it from the start. Can you just tell me a little bit about you, where you're from, and why you chose UQ-Ochsner in the first place?
Yeah, so I'm from Baton Rouge, Louisiana. So I grew up in and around Ochsner, being familiar with the system. Everyone in my family has gone there for their healthcare. And so I had a non-traditional path to get to medical school. I was out working for a couple of years before I decided to apply. And so at the time, the MCAT had changed, and UQ was one of those programs that still accepted the old MCAT, and it offered the opportunity to start sooner rather than sit out a whole nother year, go back and do the new MCAT and take a bunch of prereqs. So that played a large part in joining the program.
And could you tell me kind of your first impressions when you first moved to Brisbane, Australia?
Yeah, the move to Australia is it was relatively easy. I'll say the assimilation to Australia was so easy. The way of life, the people there are so friendly. You're immediately connected to this cohort that's all American students, and so you quickly find the people that you mesh with, and those still to this day are some of my closest friends that I met. In that first year in Australia in the Ochsner cohort. And then from there, your 2 years are pretty unique in that, pretty heavily didactic based, but you still get some exposure to the clinical side of things through all your, PBLs and clinical coaching sessions. And then transition back to New Orleans for all of your clinicals at Ochsner, which is pretty well renowned, and you get a very diverse experience in New Orleans.
Yeah, I definitely agree. I think one thing I like about this year especially is having a hospital placements. I feel like a lot of my colleagues back in the States don't really get that experience until third year. That's something I've liked about this year.
Yeah.
Um, so did you know going in that you wanted to do orthopedics, or was that something you kind of figured out along the way?
Yeah, I knew from the get go in undergrad at LSU, I worked at a physical therapy clinic where we saw a lot of the sports medicine patients. So I like the fact that patients came in, they had a problem, they had surgery, then they rehabbed and they got better. And so that was something that I enjoyed. Once you get to your clinical years, you really have to decide, are you someone who enjoys the procedural side of things, working with your hands, or are you not? And that's the first decision point, so medicine or surgery. And then from there, the surgical fields, the big decision-making tree there is what type of lifestyle, what type of patient population, what type of surgeries, how long of a surgery, what kind of tools are you going to be using. Those are all things that you decide as you experience rotations in your third and fourth years, because there's so many different nuances between even the different types of surgical specialties.
Definitely. And I know me especially, like you have this kind of notion of what orthopedic surgery entails, just looking from the outside in. Once you kind of got into the residency program, did something change that you weren't expecting, or was it kind of exactly what you imagined?
Oh yeah, I had a big change. So I went in thinking I was going to do sports medicine, gung ho from the jump, and we apply for fellowship our fourth year of residency, and so I did my spine rotation as my last rotation of third year, and realized that the feeling that I had in the OR was unlike any other, and that's what I wanted to do. So my entire resume up to that minute read sports medicine, all my research, everything about the CV. And then I talked to my program director and said, hey, I really want to do spine. And so that was a pretty day and night change to go from sports to spine. So I ended up applying to spine fellowship. And so now I'm starting spine fellowship at UAB next week. So
That's awesome. Congratulations.
yeah.
I actually did a rotation. Do you know Dr. Kane? He's over at UAB.
Dr. Kang.
He's a sports med ortho.
Okay, yeah, wouldn't have any interaction with the sports guys. Just there's
Yeah,
three guys here, and even in the spine world, you have ortho spine and neurosurgery spine. So all new things that I've learned along the way.
yeah, definitely. Well, that's awesome. Congrats, you got in.
Thanks.
Um, Going throughout like Brisbane and New Orleans, what were some key like clinical experiences or in the classroom that kind of solidified your choice for orthopedics? I know for me, especially, like I'm pretty gun ho. I want to do ortho, but it could very much change once I get into clinicals next year.
Yeah, so practical experience and meeting the people in that field are going to be the most important things. So when I got to New Orleans my third year, I wanted to get involved with the department at Ochsner. And so I found ways to get involved and make myself useful. So they do a daily sort of a didactic conference and a trauma sign out. So I started going to conference every morning just to show face, get to know some of the residents. And through those interactions, then that, anytime an opportunity came up for a new research project or a quality improvement project, anything of the sorts, I was right there. And so, hey, I'm happy to help out. And so that helped to garner some trust and develop those relationships. And then you have to be proactive. Orthopedics is one of the more competitive specialties, so you have to show that you want to be there. And so I spent a little bit of extra time on the weekends. I went in to help around and really just to take call with some of the lower level residents to see, hey, is this what I really want to do? And if it is, then how do I make myself an asset for these people to make myself stand out when it comes time to apply?
Um, and yeah, from what my knowledge is too, orthopedics is a pretty competitive specialty to get in. Um, could you tell me a little bit about your process matching, things you did to kind of stand out? I know being from UQ as an IMG, there's certain things that we need to do at least to stand out compared to the USMDs. So in your case, what exactly did you do?
Yeah, I mean, being an IMG is going to be tough, right? Because there's so many people who apply to these competitive specialties. You could always make the case from a program director's perspective is if I have, all these qualified candidates that are USMDs, why would I increase my pool of IMGs, right? That's something that we're always going to face. And so one of the ways to overcome that is you just have to get in front of these people and show them that you're willing to work hard and what your background is and where you come from, because not all IMGs are the same. I feel very strongly that the experience we get at Ochsner and at UQ is very, very different from some other IMG programs out there. But for them, they may not know that until they see you and then you get the chance to explain that. I think over the last couple of years, Ochsner has had more and more competitive matches, which certainly helps in getting the name out there and people recognize our program as something that's different. But you're still going to have challenges. And so in your third and fourth years, as for any competitive surgical specialty, you should be setting up away rotations. Now, UQ typically can't apply to the away rotation system for ortho because we're not LCME accredited. So you have to go out of your way to find any opportunities at programs that will take IMG away rotators. And they're out there, but there's not that many. Anyone in Louisiana will take us because they're familiar with Ochsner. Any program that has taken an Ochsner medical student is a great opportunity where you can reach out and say, hey, I'm an Ochsner student. You've taken one of our students before. I'd love to come sit down with you or do an away rotation if possible. There's a lot of insurance paperwork and all that goes into it. And so start early on that process. Nowadays when going through, being on the other side of interviews and seeing the interviewees come through, people are doing, 4, 5, 6 away rotations, which is ridiculous because you get burnt out doing, 5 away rotations because you're there for a month straight, taking call, busting your butt. And so if you can set up 2, 3, even 4 away rotations, I think that strongly increases your chances, because every away rotation you should think of it as an interview. And so for orthopedics, the magic number for interviews changes every year to match. My area was 8. So if you get around somewhere between 6 and 10 interviews, you're looking pretty good for matching.
And for you specifically, obviously step two is a big key factor in that. Was research as big of a role for you as you thought it was? I think for us, a lot of us are trying to get on a bunch of research early on, get a bunch of publications to at least stand out and be a little bit more competitive. But at the end of the day, is that really as important as the others?
I think so. I think there's a twofold advantage to having research on your resume. So you'll get compared not for what research you have or the quality per se, but one of the things that gets input into the application system is the number of research um, items, and that compiles all of your manuscripts, abstracts, poster presentations, whatever it is, into a total number of research accomplishments. And that is, there's an average number, per ortho applicant. And so you want to be somewhere in the ballpark to have, some things to say that, hey, if you're not average or if not above or below, somewhere in there. But the second, and I think more important thing, is that research is a great way to network and develop relationships with a lot of these attendings who then can play a role in terms of writing a recommendation letter or making a phone call or getting you into that away rotation at the program that you really want. So I think it's very, very important for the more competitive surgical subspecialties to use research to your advantage.
Thanks for sharing. So when your fourth year came around, could you kind of just walk us through what away rotations you did? Where'd you go? What was the match process like? And then going on into residency from there.
So, I ran into a lot of these challenges where I couldn't use the VSAS system to set up away rotations. So all my away and audition rotations were in Louisiana. So I went to LSU Shreveport, which is still in the state. But at that time, LSU Shreveport and Ochsner were undergoing sort of a merger where Ochsner gets involved to manage, but it's still an LSU system hospital. So they were very familiar with Ochsner and were willing to accept an Ochsner student to come and rotate. So all the insurance paperwork worked out there. And my second rotation was at Tulane, also in New Orleans. But Tulane accepts IMG rotator. So that one was a little bit easier. You just fill out the paperwork. And being from Louisiana, I had an interest in staying, and so that just worked out to my advantage to my situation. I also worked out my fourth year schedule to do my Ochsner rotation sort of during the holiday break so that I could get a third ortho rotation into my fourth year.
Yeah, and I think now they're giving us the option to do three, maybe four our fourth year. I'm not too sure on that, but I'll probably find out
Yeah,
closer.
I think it's changed a good bit because I had to, finagle the system a little bit to where I used my actual ortho block for one of the away rotations in New Orleans, and then I did my Ochsner rotation sort of outside the block, and then I set up my elective to be the LSU Shreveport away.
Got it. And then on these away rotations, how hands-on is the experience? Is it more just kind of shadowing from behind, or like what was the experience for you?
Every program will be a little bit different, and this is very specific to ortho. But as a away rotation or an audition rotation med student, you have an opportunity to be very, very helpful and integral. What I mean by that is when you take call, the call requirement will be different at every program. But when you're on call, typically you're on overnight or for 24 hours, and you're seeing consults in the emergency department with the lower level resident who's on call. And because a lot of what we do is so hands-on, whether that be putting in, some type of, traction pin, you're splinting somebody, you're doing a bedside procedure like a nail bed, or you're doing an IND of a finger. All that are opportunities where you can be helpful. So, for example, for ortho, if a patient comes in and it's someone who has a distal radius fracture, well, that they're going to need a sugar tongue splint once they get reduced. So, as a med student, you're down in the ER, you figure out where all the splint supplies are, you get everything ready, you roll out your splints, you get it all nice and neat, and you have it at the bedside ready to go. When that resident has already seen his two other consult and he walks into the room and you have everything ready to go, you're going to look like a rock star, right? Because you understand what the workflow is, how you successfully see that consult, what you should be thinking about in terms of treating that pathology, and then what happens next. So that's a great way to stand out, as an away rotator.
Definitely, that's big time. Um, and what do you think about you specifically would helped make you stand out compared to other applicants in order to match?
Yeah, I think the time that I put in, at Ochsner, with it being, my home program, and being relatively local, I would have loved to match at, in New Orleans. And so I went to conference every single day. I went on the weekends to help. I did a ton of research. And so I just showed face and developed relationships wherever I could, whether it was with the attendings, with the residents, with the OR staff. I wanted to sort of make myself an asset so that someone wouldn't have the opportunity to say, hey, we don't want this guy. So you just have to make yourself stand out.
Yeah, definitely. Um, and now, like, fast forward, you go into residency. They obviously say the first year is probably the biggest learning curve in most of medicine. What helped you kind of get through that year, and what were some big things that you learned to help carry forward throughout the rest of your years in residency?
Yeah, the first 2 years are tough for orthopedics specifically. You're in the lower level call pool. Um, year one as an intern, you go from being a medical student to where you have relatively no responsibility to now having responsibility, right? Writing notes, seeing patients, being places on time. And so that's the biggest adjustment, that and learning whatever EMR of the hospital. And so that all comes with time, times and repetition. But along that sort of journey of the first 2 years, you should always be trying to think of what the next person or the level above is doing and work towards that. And so as a lower level resident, once you get acclimated to the hospital and the workflow, now you start thinking about your specific orthopedic consults. Okay, what consult is going to come up that once I see that patient, okay, what happens next? This is what I do in the emergency department. Okay, but then the next step is, what surgery would this patient get? Now, as a second year resident, you might not be doing that surgery, but if you're thinking about it, now you're evolving in your decision-making process and always thinking about what comes next. And I think that's how you further and independently grow, without having somebody, to push you. And so then when you get to that stage, when now the attending hands you the knife and they say, hey, go ahead. Now you've already thought about what this patient has, what surgery they need, and how you're going to do that surgery. Then you look like, you've thought about it and you've prepared.
Mm-hmm. And when exactly did that happen for you when you got to do your first surgery?
So at Ochsner, there's a pretty decent amount of autonomy early on. So even as an intern on the pediatric service, I remember, doing some cases start to finish, obviously with the attending present and giving guidance. But, as a fourth and fifth year resident at Ochsner, we go down to Houma, Louisiana, and we cover a hospital where we autonomously run our own clinic, book our own cases, and essentially are fairly independent in our practice. And that's a great place to learn, because now you're out there. Obviously we have a supervising physician who's there, who helps us. But if you've now perfected your thought process in those first 3 years, that's a great place to go and implement that. And so that was one of the phases for us where you grow a lot as a surgeon.
I like that about Ochsner. I think it makes it a pretty attractive program that you can be pretty independent early on. I think that's just the best way to learn is see one, do one, and just get started. Residency obviously is a pretty time-consuming part of your life, especially orthopedics. How are you able to balance work and then just normal life throughout that experience?
It's tough, man. There's no secret.
Just
you know,
don't.
yeah, you have to work at it, right? Because there will always be times where your significant other or your family doesn't really understand, what you're going through or what you're doing, especially if they're not in medicine. They just see you at the hospital all the time, and then it just becomes a running joke that, oh, he's at the hospital, he's busy. And so when you're not at the hospital, you still have to, worry about doing your research and your studying and still make time for your family. And so you just have to be intentional. And I think if you plan ahead and you're intentional I think that's the approach. There's really no secret. You just have to try.
Yeah. Um, so now that you're done with residency, going into your fellowship, looking back, what are some things about orthopedics in particular that you know now that you wish you knew as a medical student?
Oh, that's a good question. So, one of the things you don't really cover much or appreciate much as a medical student or even a lower level resident is the nuances of practices, the financial impact of how a healthcare system works, and how you as a provider, whether a surgeon or a medical doctor, how you fit into that system, what your impact is, what you bring to the table, and how much of a commodity you are. What I mean by that is, the process of interviewing for jobs after fellowship really opened my eyes to that. And, there's a lot to be educated on that we necessarily don't see or receive any formal training on as medical students or as residents. And that's extremely important for when you are looking for your first job, right? So I've already signed for my job after fellowship. So there was a huge learning curve there in terms of what I wanted out of my practice, what kind of practice. Did I want to be private practice or work for a hospital? And so that was something I wish I knew more of going into it. But, throughout that process, there was a little bit of a struggle, but overcame that, had some really good resources and mentors to help through that with that decision-making process. And then ultimately ended up, I think I made the right decision that made sense for me, the practice that I wanted, and for my family.
It's awesome. Um, and going off that advice, I think a lot of times just people that are wanting to do competitive specialties are often told about backup plans, which is not a bad thing at all. It's smart to have a plan. But it kind of steers a lot of people away from pursuing these competitive specialties. What would be some advice about those students that do want to do pursue those competitive specialties and not settle for one of their backups, maybe?
I'm laughing because Dr. Denton sat me down and told me I needed to have a backup plan, and I told him no.
Yeah.
And I said I'm doing orthopedics one way or another. So, fortunately, it worked out for me. But it's a little being on this side of it, it's tricky, right? Because as an IMG, you have to go into this knowing there is that risk that you don't match. And so then it tests your dedication to it. Because for people who don't match in these, competitive surgical specialties, there are opportunities where you go and do a prelim year and then reapply. There are research fellowships where you can go and beef up your resume and then reapply. And that's challenging, right? Because your match rate is much lower the second time around than it is if you were applying initially. So I think you have to go into it knowing that risk is there, and then just making a decision, based on what you think makes sense to you, weighing the risks and benefits of having a backup versus going all in on the specialty that you want to do.
And when you talk about prelim, you're talking about doing like gen surge and then transferring over.
Well, doing gen surge to stay active in clinical work and then reapplying orthopedics the following year.
And then do you join as a second year orthopedic resident?
No, not typically. That can happen if there's, some type of a situation where someone dropped out and someone needs a resident. I've seen that happen. It actually happened to someone in my class, and they were very, very lucky that happened, but that's not normal.
Yeah.
Typically, you would do that prelim year and then just reapply orthopedics as if you were going through the match for the first time.
Got it. And along this journey, were there any standout mentors or friends from your time in the program that really stuck out to you?
Oh, for sure. When I got to New Orleans my third and fourth year, I became involved in something called the Medical 3D Lab at Ochsner. And the director of the lab, he's a neurologist by trade, Dr. Sarkar, but he was involved in the 3D lab as what started as a passion project, and then he found a way to become useful and built up an entire 3D lab with multiple 3D printers, found a clinical utility for the technology, and then that was a really cool opportunity for me to get involved with virtual reality, augmented reality, and 3D printing surgical cases for a lot of the complex spine stuff we were doing. And he was a great mentor. Even though he was in neurology, he had a lot of great life advice and career advice in terms of how to set myself up for success, become an asset, be useful, and continue to keep in touch with him even throughout residency.
Yeah, I think that's big. Finding a mentor, especially finding one early too, is very helpful to have along the way. All right, well, I got one more question just regarding. So now you're in Birmingham at UAB. What does this year look like? And then your future after this, where would you like to end up? Would it be back in New Orleans, or yeah, it's just what does the future look like?
Yeah, so fellowship year should be fun. From what I've learned, it's going to be very busy. So UAB is a level 1 trauma hospital, and the ortho spine service takes the trauma call this last half of the month. And so the first 2 weeks is, there's 3 attendings. And so I'll be with one of those 3 attendings operating essentially every day. There's 1 day of clinic a week. And then when we're on call, you essentially just take to the OR anything that needs surgery from a spine perspective. So it seems like there's a lot of autonomy at this program, which was a big draw. It'll be myself and one other fellow, and there seems to be lots of cases to go around, so very high volume. So I'll probably be spending a lot of time at the hospital, which, not looking forward to that. But after 5 years of residency, I can do one more, especially
Yeah.
if this is what I want to do for the rest of my life. This is actually the exciting part. And so after the year is up, I signed a job. I signed with Ochsner in Baton Rouge, which is my hometown. So going back home, and I'm going to start my spine practice there in about a year.
That's awesome. Congratulations. I'm sure it's been a very intense but rewarding journey for sure. I can tell you a lot of second years are definitely looking up to you, just trying to repeat the path you did to hopefully get into orthopedics.
Yeah, I'm glad to hear that. Yeah, stay strong, just work hard, keep your head down, and just try to make a good impression. Just remember, like, every person that you meet is an opportunity to, network and grow and develop and learn something new. So I think you guys will do great.
I appreciate it. And I thank you again for taking the time to meet with me today.
Yeah, for sure.
Thanks again, Bhumit, for joining us. And thank you guys as well. And keep an eye out for our next alumni catch up.